Hello, family and friends. Today, we will discuss migraines. September 22nd to September 28th is Migraine Headache Awareness Week. Migraines are more than just bad headaches. They're a brain disorder that comes in attacks, often with strong, throbbing pain on one side of the head. They can last hours or even days. Along with the pain, people often feel nausea and become very sensitive to light, sound, and smell. There are various types of migraines. However, we will focus on the two most common. Number one, migraines without an aura. This is the most common type, and it is described as a strong headache, usually on one side of the head, which lasts for 4 to 72 hours. Number two, migraines with an aura. Some people experience warning signals before the headache, like flashing lights, zigzag lines, tingling, or trouble speaking. So, how do migraines begin and progress? Migraines typically come in stages. Number one, there are warning signs like mood swings, food cravings, yawning, and tiredness. Number two, some people experience an aura, as mentioned earlier, like flashing lights, tingling, or speech changes before the pain hits. Number three, the actual headache phase, which is the painful part. Number four, the postdrome, which is after the headache pain, where people may feel drained or have problems focusing. So, who's more likely to get them, and how do doctors make the diagnosis? Migraines often run in families. They're more common in women, partly because hormones can play a role. Risk also goes up with stress, poor sleep, weight gain, too much caffeine, or overusing pain medications. And doctors make the diagnosis based on the history of symptoms. They will also rule out other causes, sometimes with a brain scan. It's important to note that migraines aren't random. They often have triggers such as stress, anxiety, strong emotions, hormonal changes, too little or too much sleep, skipping meals, or eating certain foods such as processed meats like bacon, hot dogs, and deli meats, aged cheeses, chocolate, food with MSG, food or beverages with artificial sweeteners, alcohol, excessive caffeine, overripe bananas, avocados, and onions. There are also weather changes, strong smells, and bright or flickering lights that can trigger the onset of a migraine. Lastly, let's address the treatment. Treating migraines usually involves two steps: prevention and quick relief when an attack starts. Prevention means taking steps to reduce how often migraines happen and how severe they are. This might include daily medications like beta blockers, seizure medications, or newer migraine-specific treatments, as well as healthy habits, including regular sleep, stress management, and balanced meals, and all make a big difference. Quick relief is what you use when a migraine strikes. Over-the-counter relievers like ibuprofen or naproxen can help, and prescription migraine medicines called triptans are also very effective for many people. There's nausea medicines like Zofran, which can help ease nausea symptoms. It's important not to rely on pain medication too often because overuse can actually cause more headaches over time. So, are there things you can do at home to mitigate a migraine? Yes, there are. Number one, rest in a quiet, dark room. Number two, use a cold pack or warm compress on your head or neck. Number three, drink water and don't skip meals. Number four, relax with meditation, deep breathing, or yoga. Number five, make it a point to track your triggers in a migraine diary. And lastly, try some herbal teas. Some people find relief with teas like ginger tea, which eases nausea, peppermint tea, which relaxes tight head and neck muscles, chamomile tea, which is calming and may reduce inflammation. And lastly, feverfew or butterbur. They have some evidence for prevention, but butterbur must be used only in a purified form because raw butterbur can be toxic to the liver. Therefore, it is imperative that you always check with your doctor first before trying any new medicine or herb. And please remember to keep a regular sleep schedule, manage stress early before it builds up, stay hydrated, eat balanced meals and don't skip meals, limit alcohol and caffeine, and add exercise into your daily routine. Migraines are not just headaches. They're a real neurological condition that can be disabling. The good news is, with the right mix of treatment, lifestyle choices, and trigger awareness, many people get good control over them. Well, that's it for today.